For the last part of your laboratory lesson, we have the toxicology of drugs of abuse. If ever na nag-wonder mo why wala na ako gi-apil ang Gonadal, so una lang jud nako ang katong adrenal and more on the toxicology. I might not include it sa finals since gamay na lang jud kaayo ato ang topics sa finals, but we will see. For now, let's go into the toxicology of drugs of abuse. So we have under here we have your amphetamines, sedative hypnotics, barbiturates, benzodiazepines, tetrahydrocannabinol, and also cocaine. We have opioids, tricyclic antidepressants, methylene dioxymethamphetamine, phenylcyclidine, and anabolic steroids. Okay, so the testing for the drugs of abuse, the specimen collection should be monitored and a chain of custody established. The screening should be simple, rapid, and inexpensive, and capable of being automated, such as your spot test. Example of screening should be your lateral flow immunoassay, which is positive results would require further testing, and the reference method would be gas chromatography, mass spectrometry. Okay, na chain of custody, meaning dapat documented should siya in every step of the way kung asan na kinsa man jud ang dapat na naga-hold ana ba. So first, let's go into your amphetamines. These are therapeutic drugs used for narcolepsy and attention deficit disorder. Overdose could give you hypertension, cardiac arrhythmia, convulsions, and possible death. And analysis, we can use the urine for analysis. Screening can be through immunoassay. Positive screening is presumptive positive only. You have to confirm it through liquid chromatography or gas chromatography. Next, we have your sedative hypnotics. So all members of this class are CNS antidepressants. Your CNS antidepressants, they act on the brain by increasing activity of gamma aminobutyric acid, or your GABA, your GABA. This is a chemical that inhibits brain activity. Okay, so that's why medyo sedative siya. And this makes it useful for treatment of anxiety, panic attacks, like acute stress reactions, and as well as sleep disorders. Okay, examples are your barbiturates and also benzodiazepines. So benzodiazepines are most commonly found or more commonly found in abuse and overdose situations. And the most serious toxic effect niya would be the respiratory distress. Okay, overdose could cause lethargy, slurred speech, coma, like we said, respiratory distress, and hypotension in the case of barbiturate overdose. Excuse me. Analysis screening can be done through immunoassay and confirmation through either liquid chromatography. For barbiturates, they are also known as your downers. This class of drugs are originally introduced as sleep inducers. Example niya would be your secobarbital, pentobarbital, and phenobarbital. Okay, and overdose can cause shallow breathing, clammy skin, dilated pupils, weak and or rapid pulse, respiratory failure, and coma. Screening is the same, liquid chromatography or gas, or liquid chromatography or gas for confirmatory, and immunoassay for screening. So these drugs are more commonly abused as downers to induce sleep after amphetamine or cocaine-induced high. So grabe nakaka-high, di kakatulog. So what you do is you take phenobarbital or pentobarbital or any of these barbiturates. So that is what drug abusers do. Okay, the presence of barbitals in urines or barbiturates in urines would indicate the use within the past 3 days. Okay, so if you're going to go into drug testing, these are the things that you have to consider. If you have used within the past 3 days, or if the patient has used within the past 3 days, it can be seen sa urine. Phenobarbital has a very long half-life when the patient, so makita pa sa urine, if nag-use siya phenobarbital, if within 30 days. Next, we have benzodiazepines. This similar structure and action as your CNS depressants. Okay, one of the drugs more commonly prescribed because of the minimal side effects and also the efficacy. Okay, under your benzodiazepines, you have your diazepam, diba, Valium, you have diazepoxide or Librium, lorazepam, Ativan, alprazolam, or Xanax. So if you watch a lot of American na mga series, these are common terms that common medications that you will often hear that are being abused. Xanax, Valium, Ativan, okay, mga CNS depressant. Okay. Overdose can cause shallow breathing, clammy skin as well, dilated pupils, the same lang gihapon siya. Cannabinoids or tetrahydrocannabinol or THC, they are a group of psychoactive compounds found in Mary Jane or your marijuana or your marijuana. Okay. So example would be your tetrahydrocannabinol and your marijuana, of course. Overdose could cause extreme anxiety or panic attacks, hallucinations, fast heart rate, uncontrollable shaking, and unresponsiveness. The half-life of this could be 3 to 5 days if chronic use. Okay, sample, we can use urine. Metabolite niya is the tetrahydrocannabinol COOH, and the screening is through immunoassay and confirmatory is GCMS. The metabolite niya, which is the tetrahydrocannabinol COOH, can be detected in urine 5 days after a single use and 4 weeks following chronic heavy use. If you're a chronic heavy user of marijuana, you can it can be detected sa imong urine even 4 weeks after the last time you nag-use ka. Okay, but if first time user ka, it can be detected in urine and cleared within 5 days. Okay. Hashish, okay, that is the processed product of marijuana that can be smoked or ingested. That is what the term is, the hashish. HASHIASH. Okay. Cocaine. Okay. Cocaine, this is an effective local anesthetic which at higher circulating concentration, it is a potent CNS stimulator. Okay, so it is not a depressant, it is a stimulator that elicits a sense of excitement and euphoria. Example would be crack, di ba what we say, crack cocaine. And an overdose could give you hypertension, arrhythmia, seizure, and myocardial infarction. That's why a lot of people experience heart attack pag mag-overdose sila on crack cocaine. Half-life is 30 minutes to 1 hour. Clearance is through hepatic hydrolysis, and the product is benzoylecgonine. The half-life of the product would be 4 to 7 hours, and the screening is through immunoassay, and confirmatory is to gas chromatography. So crack, this crack, okay, is the free base form that is inhaled as a vapor. The cocaine can also be administered via insufflation or intravenous injection. Insufflation of cocaine, okay, ganing ginaingat na insufflation, is also known as snorting cocaine. Okay. Clearance, Ana, is through rapid hepatic hydrolysis. And the urine detection of the product can be, excuse me, if this is the first time na mag-use, it can be detected sa urine 3 days. And if chronic heavy user ka, it can still be detected up to 20 days after the last dose. Okay. So, the amount of time before the drug clears from your system or from your urine depends upon how heavy of a user you are. Drug user. Okay? Dili ako katong heavy user. Next, we have your opioids, which is derived from your opium poppy, okay, na plant. This is a class of substances capable of analgesia, So it is an analgesic, sedation, and anesthesia. That's why opioids heavily controlled by the US government. Example under your opiates would be your opium, morphine, codeine. Chemically modified opiates would be your heroin, oxycodone, hydromorphone, and an example of your synthetic opioid is your meperidine, propoxyphene, fentanyl, methadone, pentazocine, zokine. Okay. And then the overdose is respiratory acidosis, myoglobinuria, increase in cardiac damage indicators. Indicators niya, of course, would be your CKMB as well as your um, troponin. Analysis, half-life is 1.5 to 7 hours, and the screen immunoassay and confirmatory is GCMS. Okay. Okay, we have your tricyclic antidepressants, your TCA. These are used to treat depression and mood disorders. They block the reabsorption of serotonin and norepinephrine and increases levels of these two neurotransmitters in the brain. Examples of these would be your imipramine, amitriptyline, and doxepin. Overdose can cause ventricular tachycardia or cardiac dysrhythmias. Okay, imipramine, the first one, is the first tricyclic antidepressant used for depression. Okay, for amitriptyline, let's see, metabolite is the cipramine, doxepin metabolite. Let me see. Okay, these three examples are toxic at 500 nanograms per ml. Okay. Um, okay. Anyway, therapeutic concentration of these three would be 175 to 300 nanogram per ml. Next, you have your methylene dioxymethamphetamine, an illicit amphetamine derivative, also referred to as your ecstasy, MDMA, or your ecstasy. These are primarily administered orally in tablets of 50 to 150 milligrams, and other ways of administration is through inhalation, injection, or through smoking. The overdose can cause headaches, nausea, vomiting, anxiety, agitation, impaired memory, violent behavior, tachycardia, hypertension, respiratory depression, seizures. Okay, so other than that, we have your seizures, hyperthermia, cardiac toxicity, liver toxicity, and renal failure. Analysis, half-life of your ecstasy is 8 to 9 hours. The onset of effects can start from 30 to 60 minutes with a 3.5 hour duration. Screening is through immunoassay and confirmatory is through GCMS or liquid MS. Next, you have your phenylcyclidine or phencyclidine or PCP. Phencyclidine or PCP. This is also known as your angel dust. Okay, angel dust. This is an illicit drugs with stimulant, depressant, anesthetic, and hallucinogenic properties. Examples here would be PCP laced tobacco or marijuana. Overdose can cause stupor or coma, and it can be detected in urine up to 30 days. Screening is through immunoassay, confirmatory is through GCMS or liquid chromatography MS. Next, we have your anabolic steroids. In the 1930s, this is used as a therapy for male hypogonadism. So they are a group of compounds that are chemically related to the male sex hormone testosterone. Examples are your nandrolone, oxandrolone, oxymethylone, stanozolol, trenbolone acetate, fluoxymesterone, mesterolone, methyltestosterone, danazol, or straight up testosterone. Pero overdose niya would be atherosclerosis, platelet aggregation, stroke, myocardial infarction. In males, it could cause testicular atrophy. Okay, wow, that's why they say na pag nag-steroids ka, nagagamay ang testicular area. Sterility, impotence, okay, nagabaog. Females can have masculine traits because of the excess in testosterone. Breast reduction and sterility gihapon. Yung buog gihapon. Analysis, screening would be the ratio of testosterone to epitestosterone, and confirmatory is through GCMS or LCMS. And that is it for your drugs of abuse.